of pneumonia. This day exists to raise public awareness of pneumonia, a preventable and treatable disease that still claims the lives of our most vulnerable children under 5. The theme today, Defeat Pneumonia, Every Breath Counts, Every Action Matters, reminds us that every breath a child takes must be a right, never a risk. To defeat pneumonia, we must act boldly because every breath counts and every action saves lives. Pneumonia remains one of the leading causes of death among children worldwide, killing more than 700,000 children under 5 years every year, more than any other illness across the globe. Every 43 seconds, a child is lost to pneumonia. But behind these numbers, our family is devastated, futures extinguished, and communities left in mourning. We cannot allow these tragedies to persist. As a country, Kenya has made real progress, yet gaps remain. The 2022 Kenya Demographic and Health Survey showed that only 43 or 4 out of 10 children with symptoms of acute respiratory infection received care within 48 hours. Pneumonia kills fast, and therefore care must be earlier, closer, and affordable. That is why we are strengthening primary health care as our front line and urging all households to register under the Social Health Authority so that financial barriers do not delay life-saving care for children. I want to congratulate Siaya County Government for the efforts you have made. We were at an outreach in Mulaha, and we saw how integrated primary healthcare services work, bringing together everybody under one roof. And the reason we promote primary healthcare approach is that because it's a proven intervention to deliver universal health coverage, because primary healthcare systems tend to be comprehensive, they are integrated, they promote inclusivity and equity, and therefore is in line with our mantra of universal health coverage of leaving no one behind. Our response towards this challenge rests on 3 pillars. 1 is to protect, 2 is to prevent, and 3 is to treat. And we saw the skits that were performed here by Kababa, our CHPs, and our young clinicians in training. Those skits spoke to these 3 pillars of protection, prevention, and early treatment. Protection begins at home through exclusive breastfeeding, good nutrition, clean energy as our fuel for cooking, to reduce indoor air pollution, and a strong water sanitation and hygiene measures in place. Prevention demands vaccination coverage of at least 90% against pneumonia-causing pathogens. And as a country, we continue to invest in our vaccination program, fully funded by the government. And for this financial year, Kenya government has already paid its full complement of resources to Gavi, the Global Vaccine Alliance, to ensure an uninterrupted supply of vaccines for our children and pregnant women. Again, I want to applaud Siaya County Government for achieving high vaccination coverage of nearly 9 out of 10 children. But through our Madaktari wetu wa nyanjani, our CHPs, let us work together to ensure that that one single child, the 10% that is still remaining, also is not left behind. walk through from household to household, verify the vaccination status of children under 5, and link those who have not been vaccinated to the facilities so that children don't only get their right, but then they'll be enabled to thrive and achieve their full potential and ensure economic prosperity of our great nation. Treatment must be timely and effective. And I want to congratulate the principal of KMTCs here. I think the skit that you did shows that the knowledge that you are imparting onto our students is up to date and is accurate. Continuing that trajectory. To bring care closer to families, the ministry has trained more than 107,000 community health promoters on integrated community case management for under 5s. Community health promoters educate households on prevention. They help households and families identify danger signs early. They provide the initial management where appropriate and ensure timely referral. This is real primary health care in action, where early detection, quick and timely referral, and better treatment for better outcomes work. Together with county governments, we have expanded access to pneumonia case management in communities and health facilities, especially in remote and underserved areas. Every child deserves access to life-saving treatment regardless of location or income. Social Health Authority registration complements this by reducing out-of-pocket costs and encouraging early care seeking. Across Kenya, most health workers have been trained in facility-based, integrated management of newborn and childhood illnesses, equipping them to assess and manage pneumonia and other childhood conditions. To strengthen care for severe cases, the ministry, supported by our partners who are present here today in their tents, has established oxygen plants in all county referral hospitals and trained healthcare workers from 26 counties on medical oxygen use, maintenance, and safety. And it is only 2 weeks ago again when the Ministry of Health, with the support of Global Fund and AMREF as the logistic leaders, rolled out more than 470 multi-parameter patient monitors, oxygen flow meters, and oxygen analyzers to all facilities throughout the country. So we are building the oxygen ecosystem or ecosystems from where we were before COVID-19 of 16% to more than 70% currently. This is work in progress, and we believe in the foreseeable future, all our facilities will be able to have piped oxygen, we'll have liquid oxygen tanks, we'll have PSA plants to ensure uninterrupted oxygen supply to all our facilities. We will never again be caught flat-footed like we were during the COVID-19 pandemic. We have finalized the 2025 Integrated Management of Newborn and Child Illnesses Guideline Review and developed a scalable infant and child mentorship package to enforce competencies, promote adherence to national guidance, and institutionalize continuous quality improvement from community to different referral levels. These instruments will be rolled out through routine supervision, mentorship, and data-driven performance reviews, both at national and county levels. They complement our investments in primary care networks, reliable oxygen ecosystems, and strengthen supply chain pathways, ensuring that essential commodities from amoxicillin dispersible tablets to pulse oximeters and oxygen are available at the right place and the right time. On this World Pneumonia Day, let us renew our collective commitment to strong primary healthcare systems, timely care, or high immunization coverage, clean household air, and financial protection as we seek for care. Together we can turn the tide so that no child under 5 in Kenya or anywhere else in the world dies from a disease we can prevent and cure. It is now my honor on behalf of the Cabinet Secretary to launch the following key documents to strengthen child health services nationwide. 1, the norms and standards for establishing pediatric care. Number 2, infant and child mentorship package. Number 3, the revised integrated management of newborn and childhood illnesses 2025. And finally, the revised mother and child handbook 2025.
Mkurugenzi mkuu, tusaidie sasa tupatie when there is no pneumonia. So I will start with the LifeNet. I will invite Whitney Claire to come briefly and greet our people and say something in relation to the World Pneumonia Day. Karibu sana.
My name is Whitney Claire from LifeNet International, and it is truly an honor to join us today as we mark World Pneumonia Day 2025.
Asante sana, you can take your seats. And now to proceed very fast with the program. Who are in attendance today, please stand wherever you are. Asanteni sana. Some of them are here and some are behind our... Karibu chief, karibu. And all the other waziris who are in attendance, our county commissioner, our partners, good morning. As has been mentioned, as Siaya County, we are very proud that we were selected to host this year's World Pneumonia Day. I'm sure that the selection was not just because of the burden of disease.
First, please. Wahudumu wetu wa Wizara ya Afya. Wahudumu mko na vitabu?
We are coming there.
Kila mtu ashike kitabu chake. Shika kitabu. Vitabu viko huko nyuma. Kila mtu ashike kitabu. Sera ziko, miongozo iko.
Na mbona irotate sasa? Wamezima.
CHPs. Make a circle.